On today's podcast,
if you've got an inflamed gut, you've got an inflamed brain. And kind of a classic symptom of blood-brain barrier permeability is brain fog and depression, especially if it sort of like comes and goes with no clear sign of neurodegenerative issues yet. That's sort of a sign, let's pay attention because it's not benign. These symptoms can happen up to 10, 20 years before you'd ever get some sort of actual neurodegenerative issue. And none of us want that.
if you're a healthcare provider tired of just treating symptoms and ready to dig deeper into the root causes of health issues, the Vibrant Wellness Podcast is for you. With insider tips, expert interviews, and the latest in biotech research, this podcast will take your patient care to the next level. Hello, everyone. Welcome back to the Vibrant Wellness Podcast. I am so pumped about today. Dr. Emmy, how are you doing today?
I'm doing well. It's officially summer. What about you, Jen?
Is it? I missed that completely. I didn't know. But I'm excited about that.
Yeah, I'm happy about that.
But even more exciting, today we have the incredible Sara Barthel with us. She is a functional medicine champion with many credentials and specialties under her belt, a few of which are certified nutrition specialist, licensed dietitian nutritionist, and certified gluten-free practitioner. She has a powerful story of personal healing to share. Sara knows what it's like to face challenging health issues head on and come out stronger on the other side, even when you seem to be doing all the right things. Sara firmly believes in the interconnectedness of our bodies, particularly when it comes to the gut-brain axis. She's discovered firsthand the profound impact that healing her gut had on her overall well-being. Her transformation, honestly, is truly inspirational. Her mission is to help others harness the innate healing process of their bodies, taking charge of their health and living vibrantly. She wants you to live life, on your terms, and I am here for that. So I can't wait to dive in. Let's get this convo started. Welcome to the podcast, Sara.
Thank you so much, Jen. I'm so excited to be here talking about this.
As are we.
We're happy to have you, Sara. And that was such a great intro, Jen. And I think that was just the tip of the iceberg. You've done so much, Sara. And I really want to start this conversation with letting the listeners know you started this journey as an Iron Man. I want to say Iron Woman triathlete with seemingly good health on the outside, but experiencing some not so obvious signs of dysfunction on the inside. Do you mind sharing your story with us?
Yeah. So it goes back probably 10 or 15 years now. And I mean, at the time I was a vegetarian, I was an ultra endurance athlete. And so and I was, like I said, I was a green smoothie drinking Ironman triathlete and, seemed to be doing all the right things, drinking tons of water, lots of fiber, lots of veggies, very active. And I just was having this growing list of health issues and stemming from the gut. And from the outside, I mean, people would just be like, basically discount me because I wasn't showing any external signs besides maybe more skin breakouts and issues, which I later put together. But, inside I was just, my digestion was a mess and it was absolutely miserable. And I started going to different doctors and specialists and really coming up with absolutely nothing. I was begging them for something I could do that would make me feel better. Because I felt like I was doing everything right. I was, I would drink tons of water and coffee, go for a run, fiber, like nothing worked. I mean, we're talking stretches of 3 weeks where I couldn't go to the bathroom no matter what I did. And I was just desperate. I mean, after a couple of specialists, and they were basically like, you don't have cancer, and here's a pill to help with the constipation. And I was just basically fired that GI doctor, and I was so frustrated. And so I really just took things into my own hands at that point. And it kind of, I always been interested in nutrition and functional medicine, but I really dove in. And I think that's the story with a lot of us in this space is it started with our own health journey. And so as I started digging in, it sort of began my career shift into nutrition and functional medicine. and just kind of figuring out, okay, I've got some autoimmune thyroid issues going on I didn't know about, severe gluten sensitivity, nutrient deficiencies, dehydration despite drinking tons of water. There was just a list of things that as I started to, and reducing toxic burden, changing my water, like all of these things that added up really made a massive impact, and just had ripple effects on my health. And so that's what I want to take to other people and what I do with working with my clients as well.
Did you start researching, or I think you mentioned you had a friend who was using functional medicine.
Yeah.
Yeah. And so I'm wondering, and did
Yeah.
you find a practitioner at the beginning of this journey to kind of help you, or was it pretty much all self-taught? Sometimes we have to do that too.
Yeah. So I did both. I think my first introduction to functional medicine, specifically in terms of the life-changing effects of it and seeing it play out in front of my eyes, was a friend of mine in San Diego who was diagnosed with multiple sclerosis. She had 7 lesions on her brain. She was going blind in one eye. And basically her options were, which wheelchair do you want? Which medication do you want? And she was like, I'm not doing that. And ended up finding like an Ayurvedic neurologist and a functional medicine practitioner. I believe she actually worked with Dr. Walls. And so just seeing the effect of basically diet and lifestyle changes, and she could see as soon as she would go off of those lesions would start coming back. So it was really, and she never went on the medications. We're not saying that's for everyone, but I just saw the power of it and how incredible our bodies are at healing and restoring, when we give them half a chance.
It's so empowering.
It is. And it just is a reminder that, you have to advocate for yourself and you have to educate yourself. And it's so important in this space, especially. And kudos to you. I imagine it was probably a absolutely overwhelming mountain to tackle because, like you said, there were so many things involved, but your test is your testimony now. So that's amazing.
Yes. And I did find a functional medicine practitioner to work with. And so that was what kicked off really running a whole bunch of labs and discovering all of these things was what started me on my journey to going back to school. And my undergrad and my master's degree were in counseling psychology. So I had no science. And so just going back while working full time, discovering I love biochemistry was also a fun discovery. Yeah. But it was years in the making. So
the psych and the counseling component are extremely valuable too.
Yep.
So one thing leads to another. You build these skills. It's really helpful. What about the traumatic brain injuries? You said you had 2 back-to-back TBIs.
Yeah. And so that was another element too, is just understanding as I'm trying to heal my gut, I had a couple of brain injuries. One, I still don't really know what happened, but I had ended up passing out and getting 5 staples in my head. I had a concussion. And shortly after that, I was driving home from work on the highway in San Diego and got a car cut off me in a semi and sent us spinning on the highway, and the semi totaled my car. And I ended up backwards on the highway with rush hour traffic coming at me. And so had another brain injury back to back, and just realizing that the impact of, traumatic brain injury or any sort of head injury, it immediately opens up gut permeability. It immediately opens up blood-brain barrier permeability, tons of inflammation. And it just sort of it's a setback, but it's something that a lot of people I work with have experienced at one time or another. So I think just having that really thorough intake and asking a lot of questions and just being really curious is a critical part of being a good practitioner. Is gathering all that information that may not seem connected.
Right. And this was during the time you were trying to figure out your GI issues. Is that right?
It was shortly after. I was in a good spot and, pretty stable. And it was definitely a setback, but that also set me down a path of just kind of understanding the brain and, realizing that I am an ApoE4 carrier too. And so putting that increased risk of Alzheimer's and neurological issues on my radar also just kind of sent me down a path of just wanting to learn a little bit more about what I can do and really understanding at that point what a strong connection the gut and the brain have on so many levels.
Yeah, it's incredible how some experiences just stack up to serve us in the end if we can spin it that way and see it that way. And even though they're painful experiences, but now you have that knowledge about the gut and brain axis, and you're helping so many people. So I'd love to really understand, once you started to put together the pieces, did you have a personal light bulb moment at all that helped you understand the gut brain axis, or can you share maybe one of the most fascinating facts for you in terms of this intricate system?
Yeah. So, I mean, the reality is that probably, I think I've heard over 70 million Americans have some sort of a digestive disorder. And so that's always where I've specialized is working with women with IBS and digestive disorders. But I think a light bulb moment for me was just polling my audience recently and finding out that despite the fact that they'd come to me for IBS, it was really the brain issues that were their number one struggle and their number one thing that they're trying to address. I think a lot of women just learn to, when it comes to anxiety, mood issues, brain fog, fatigue, it makes it really hard to function. And, it's basically, they both show up at the same time is a constant thing that I've seen. And so if you've got leaky gut, the infections and inflammation get into your bloodstream and get carried over your blood-brain barrier. And so anytime I hear any of those symptoms, brain fog, fatigue, just anxiety, depression, I'm thinking, okay, what's going on with the gut and the brain? Because when that crosses, the inflammation crosses the brain, it can really carry it systemically, and it shows up wherever you've got a genetic weak link.
And I find some patients, they don't even have GI complaints, right? It's maybe more so the neurologic, as you said. They're having difficulty sleeping, headaches, irritability, etc. But then if you do a stool test, you see, okay, well, there's some dysbiosis that we can definitely address and optimize there. So, and there's so much more in terms of digestion and short chain fatty acid production, all of that. So important.
And that's why I love testing. Is one of the first tests that was run on me was a wheat zoomer. And I was told that I had severe gluten sensitivity. And I was like, no, it's fine. I don't have any symptoms when I eat gluten. I'm loading up on bagels and pasta before races and stuff. But it's just so important because a lot of people are coming with like eczema, psoriasis. Sometimes it's diarrhea, constipation, but like fatigue, depression, brain fog, joint issues. And all of those things point back to the same underlying cause, just chronic inflammation. And so a lot of times we're not even aware until we run lab tests.
Yeah, totally.
I want to get a little bit more granular on the relationship with the gut brain. And it's always fascinating to me, not being a clinician, how the gut and brain, seemingly unrelated areas, are so intertwined. Could you shed some light on the underlying mechanisms that connect anxiety and digestive issues a little bit more? Because like you said, I'm assuming the clientele that you work with, that's a symptom that they're dealing with a lot.
Yeah, definitely. I mean, when you've got chronic, I feel like I am always telling people everything goes back to the gut, but when you've got chronic gut inflammation or things like IBD, you've got intestinal permeability, it crosses the blood-brain barrier. So for instance, increased zonulin. These levels are found in celiac and intestinal permeability, and it puts people at risk for blood-brain barrier permeability. And once that membrane is permeable, things that should never be crossing into your brain can get in your brain, and it carries infections and inflammation, inflammatory cytokines, environmental toxins that should never be getting up into the brain. And so, I found that healing one tends to heal the other. If you've got an inflamed gut, you've got an inflamed brain. And kind of a classic symptom of blood-brain barrier permeability is brain fog and depression, especially if it sort of like comes and goes with no clear sign of neurodegenerative issues yet. That's sort of a sign, let's pay attention because it's not benign. These symptoms can happen up to 10, 20 years before you'd ever get some sort of actual neurodegenerative issue. And none of us want that.
Yes. True. And you brought up lab testing, just for that data that you can get. I'm curious, some providers tend to have sort of like a set protocol they like to use on all incoming patients. Working with your clientele, do you tend to wait till after you sort of have that first consultation, or do you have a sort of protocol that you like to run on all your clients?
Yeah. So I do my initial intake session, always it's foundational, just filling out, basically gathering your whole health history, doing a medical symptoms questionnaire, collecting all of that information, and just making sure I have all of those pieces of the puzzle that are necessary. But I would say by and large, my foundational labs that I run on almost everyone to start out with are a gut zoomer and a wheat zoomer.
Okay.
And that's because of kind of what we talked about before, is if there is, the wheat zoomer is my go-to just because it's such a great marker, or a great lab for intestinal permeability. But it also looks at LPS or lipopolysaccharides, which are an indicator of, they cause intestinal permeability, but they're an indicator of if there's some sort of chronic infection going on somewhere else in the body. And then we can start to figure out, is it coming from the gut? And that's what the gut zoomer answers. Or is it coming from somewhere else? Maybe they're having chronic UTIs, chronic sinus infections, asking about, their mouth. The oral microbiome is looking like it could be a strong contributor to where SIBO bacteria is coming from. And so if there's some sort of infection, maybe they bleed a little bit when they floss, or there's some swelling in their gums, or they've had a lot of dental work done, it's somewhere we want to really zoom in on. But LPS also is really strongly associated with brain inflammation. So it's not just the gut. And so a lot of people are like, I don't, and it also tells us if you're anywhere on the gluten sensitivity celiac spectrum, because it does exist on a spectrum. And, if you're a carrier of any of the genetic markers that predispose you to celiac disease, it's kind of like, let's turn things around before you ever completely lose oral tolerance and develop celiac disease, where your ability to kind of absorb the nutrients on the microvilli is completely destroyed. And that just worsens things, and it complicates and prolongs the healing process. So the earlier we can find it and address it and start to heal it, the better.
Yeah. I'm so glad you mentioned the oral microbiome. We actually recently did a podcast with another provider who specialized, he was a dentist. And so it's just so fascinating to even hear us talk about that and the connections, again, that you wouldn't normally think of.
I never thought I'd be so interested in people's oral health, going into nutrition and gut health. It definitely was a surprise to me, but something I always ask about.
Yeah. Yeah.
Important.
Well, my next question is, like, now you're armed with all this data, right? And I've had several lab tests done. I know how overwhelming it is just to look at the information that they're giving you. What's your process for translating these results to your clients in an actionable sort of plan?
Yeah. So usually I'll take time to just go through. I love educating people. Some people don't, they just want to know, what do I do? What don't I do? But I really want to take the time to educate them on why, because I think there's power in understanding and seeing the data. If they're going to invest in lab data, one, I want it to make sure that it's accurate. And two, I want to make sure that, they can see, here's where the damage is being done. Here's what we can do about it. And it sort of provides them just a clear data-driven path that we know we're on the right path. And I can't tell you how many times I've had people cry as we're looking over lab work, because it's almost like they finally get validation for how they've been feeling.
Yeah.
And they finally have answers to, even if they're not excited about whatever it may be, a pathogen or an infection or a gluten sensitivity, there's something freeing and empowering about finally knowing what the underlying causes are and being able to do something about that.
Yeah, absolutely. And it sounds like because you start with that why, and I think that's so important. And for all the providers listening, I think they can take a page out of your book if they're not already doing that. But I am curious, like if and when you have any compliance issues, do you have any tips or tricks for other providers listening on how you sort of approach those types of clients?
Yeah. And so from there, to kind of touch back on your last question too, once we take all of the intake information, the lab data into consideration, we can kind of come up with a plan of, nutrition, diet, lifestyle, supplementation, any additional lab testing that might be beneficial to rule things in or rule things out. But really, when it comes to compliance, it's very case by case. And so some people are fine if I just dump a ton of information on them. Here's the entire protocol, and they'll just order everything and go to work, and they thrive on that. And other people, get kind of overwhelmed and paralyzed if it's too much information. And so I think it's also just understanding people's motivation for change, what they need support with, what's worked or what hasn't worked in the past. Maybe for them, it's like, let's just start with this and this, and then we layer in, a couple more things, and we check in a little bit more frequently. And when it comes to, gluten is where I start a lot of the time. If there's a gluten sensitivity, if there's brain inflammation, gut inflammation, it's just so important. And it keeps people kind of in this stuck, sick cycle. I trained under Dr. Tom O'Brien and his clinical team. And so as a certified gluten practitioner, obviously I don't want to vilify any one thing, but I've just seen it in the research and in clinical practice over and over. Going gluten-free helps with everything: brain inflammation, infections, indirectly, because it sort of calms down the immune system. And then again, with, if there's gut issues, there's anxiety, depression, mood issues. Once people start feeling better and thinking more clearly, we know we're on the right path, and they're even more motivated to make more changes.
Yeah, you kind of get that snowball effect going.
Yep.
And we often talk about just meeting your patients where they're at. And that's clearly what you're doing, by having that initial consultation, really gauging where they're at. So thank you for sharing that, Sarah.
Yeah.
And so we talked about the Wheat Zoomer and the Gut Zoomer, but I know you also run the Neural Zoomer Plus, Sarah.
Yes.
I'm curious. Yeah. What do you find most useful about that test? I think it can be intimidating to some practitioners. And I'm curious, how long do you find those? How long does it take for those markers to normalize or go down? And are there any specific markers you find really pivotal in certain cases? I'm curious, all things Neural Zoomer Plus and how you use it.
Yeah. So the Neural Zoomer Plus has, when we're specifically talking about blood-brain barrier permeability, there's 4 markers specifically that look at antibodies that would indicate blood-brain barrier breakdown. So for instance, S100B is one that's strongly associated with blood-brain barrier permeability, but it's just important to monitor in all autoimmune disease. It also looks for viral load, and that's something that's really critical to inflammation, to autoimmunity. Epstein-Barr, herpes simplex. Even there's some indicators in there too about what's going on with like diet and lifestyle. Because, for example, gluten antibodies technically can't get into the brain unless it's permeable. And then if it is permeable, then it can bind to your cerebellum, since there's kind of a similar protein structure with the astrocytes in your cerebellum. And so basically molecular mimicry is essentially the mechanism there. But this happens with high toxic burden too. Those chemicals that we're exposed to, or maybe that we inhale, that should never cross our blood-brain barrier, can cross in and bind. And so I find that, these markers are really important to look into, just because we can see where things are trending in the wrong direction and, move it around and turn the ship around. Essentially, it's called the prodromal period, where you have elevated antibodies, but maybe you don't even have any symptoms yet. And as I mentioned, that can be 10 to 20 years in advance. So I think it's empowering to know, we've identified this before you even have any symptoms, and we can make changes. with gluten specifically, I would say like anti-Purkinje cells and anti-cerebellum, we want to rule out gluten. So that's where those 3 tests could go really well together. I think the antiglial fibrillary marker is the only actual diagnostic marker in there, but they're all, when we combine it with their symptoms, I think a lot of it can really provide a lot of guidance to see, do we need to knock back viral load? Do we need to heal the gut to heal the blood-brain barrier permeability? As I mentioned, going gluten-free is important, but sometimes there's a marker in there called anti-aquaporin 4. And so if there's antibodies to that, like it's usually corn and soy. So aquaporins are like corn, soy, tomato, spinach.
Yeah.
If there's molecular mimicry there, it can lead to demyelination and things like that. So then we might want to run a lectin zoomer just to see what's being affected and if that's something you need to remove. And interestingly, there's on the lectin aquaporin test, there's a tobacco marker that I was scratching my head over because I kept having people show up as being sensitive to tobacco. And they're like, I've never smoked, but as I dug a little deeper, I was realizing, tobacco is actually found in many air fresheners. And sometimes as a substitute for glyphosate and pesticides on organic crops. And so some people are testing, I would just kept seeing this pattern of people testing positive for tobacco antibodies. And they're like, I've never smoked. And so,
it too.
It's just another reminder that it's not just about cutting out the foods. It's really a holistic approach, nutrition and sleep and stress management and, supplementation as needed and just cleaning up your environment, sort of reducing that toxic burden and supporting, your liver, your lymphatic system, your detox pathways.
Right. And do you repeat the neural zoomer in certain patients and those antibodies go down after intervention?
Usually they want to see they want to see those antibodies going down and make sure that the plan that we put in place is actually making a difference. So usually I'll retest in about 6 months just to give those time to start coming down.
Right. And you feel like that's enough time to start to see them coming down. That's kind of my advice also, is about 6 to 8 months. Take some time. Yeah.
Yeah.
It's a process.
And some people just start feeling better and they don't care to retest because, they can tell a difference.
Of course. And then I think it can also maybe cause some anxiety in folks if they're, they're thinking, well, if some things aren't budging, but I still think that's valuable for practitioners to say, well, where else can we look? Are there toxins that need to be addressed, as you said, or maybe a different food sensitivity? So I think that's
really
valuable.
environmental. Yeah. Like you said, people remove gluten, but if we retest the wheat zoomer, for example, and they're still showing up as gluten exposure, and their immune system is reacting as such, either there is some sort of contamination that they're being exposed to, or there's, because it's so sneaky, but then there's also cross-reactive things to gluten, like corn and dairy and even candida. So then digging into like the candida yeast mold pathway, going down that rabbit hole.
There's always something. It's true. Yeah. Because we can really focus on optimizing and looking at other tests when we're trying to do this. And I'm curious, Sara, about other food sensitivity type tests. You already touched on the lectin zoomer in addition to the wheat zoomer. But do you run other food sensitivity panels, maybe in certain patients who maybe they're not so in tune with their body? And we know food sensitivities, they can present quite ambiguously because they're delayed onset. They can affect every body system. So when and do you mix in other food sensitivity testing?
Yeah, and sometimes that's pretty case by case too. A lot of times people suspect that maybe they're reacting to certain foods. And in that case, we'll either decide to do an elimination diet and do it that way, which is currently the gold standard, or, with some of the other food zoomers. I mean, wheat zoomer is by and large the one that I use all the time, because if there's intestinal permeability, that's the gateway to developing other food sensitivities. It's the gateway to systemic inflammation. You can't have autoimmune disease without intestinal permeability. So that's my starting point. But some people need to know, especially, dairy is a big one that's cross-reactive, and a lot of people, especially with autoimmune disease, are reacting to, and it's triggering their immune system. That's probably the second one that is the most commonly tested. And then any of the other food zoomers really zoom in at that peptide level. So we're not just looking at, is that entire peptide sequence leaking through the intestinal permeability, but are snippets of it, which is more realistic and more likely to happen. And if so, what is that? How is it affecting them, right? There's markers that might tell us if it's affecting their skin or their brain or their gut, and we can just know why we need to pull that out. The food, like the longer list of food sensitivities, like with Vibrant, the food sensitivity panels 1 and 2 is going to provide a huge list. And with things like that, I always like to remind people that it's not just about, pulling out all those foods isn't going to heal them. It's really doing all of the other things too, to reduce inflammation, to restore the gut barrier function, and, repair that pathogenic intestinal permeability. And then the last thing I want to see is someone come back to me 3 years later and they're still not eating any of those foods. Because ultimately the goal is maximum dietary diversity. So what I've seen is most of the time with other food sensitivities besides gluten, they're able to eventually reintroduce those. And that's really what we want, is people eating as much diversity and color as possible, because that's the number one marker of gut health and overall health.
Yeah, I agree. Yep. And I find when you see a huge variety of positive reactivity on the food sensitivity panel, I think about digestion, in terms of, okay, well, these are whole proteins. Why are we not digesting these down? And why are we having this immunological response? So yeah, there's so many other little clues you can get from that test. And thank you for pointing out, we don't want to restrict people to the point where years later they're struggling and they think they're still sensitive, because these things are dynamic and they change. And, save for gluten and wheat, there's very, very compelling evidence out there. It's just very unique in how inflammatory it is.
Yeah.
But yeah, that's really, really important to point out. We, want to trigger issues in certain folks or create issues. So now I'd love to jump into irritable bowel syndrome with you, Sara, because I know that's another specialty area for you.
Yeah.
You touched on this a little bit before, but I found it's estimated that 60% of people living with anxiety or depression have chronic intestinal issues such as IBS. So, and really touching in on the link between mental health issues and IBS, because that's really fine too.
Yep. So I feel like IBS is sort of this umbrella of symptoms that most of the time they get a diagnosis because they can't figure out what else it is. And so it's really important to come in and look at, according to my research, there's at least 24 different IBS factors. And so, we need to look at infections and stress anxiety and dysbiosis. So that's one of the things, the gut zoomer, the stool test is great at looking at, if you have an overgrowth or insufficiency dysbiosis, of maybe an overgrowth of bacteria. Up to 80% of people with IBS, it's actually SIBO, or they have both. Insufficiency might just be they don't have enough of the protective bacteria or butyrate-producing bacteria, which, butyrate and short-chain fatty acids are critical for brain health, for systemic inflammation, for feeding your colonic cells. And that's something that we look at. The list goes on, but, and it might be vagal tone. Constipation, for example, is predictive of neurological issues like Parkinson's decades in advance. And so, or at least 10 years in advance. And so it's just important to understand that it's, what happens in the gut doesn't stay in the gut. And clearly that with issues with digestion and anxiety, there's a really strong connection. And so we want to figure out what's causing that. And a lot of times too with IBS, I'm finding that undiagnosed or uncontrolled autoimmunity is at play. Mm-hmm. And seeing that in a pretty big number of patients where we're looking at, we order comp metabolic panel, just a really broad spectrum blood work as well. And we can kind of see what's going on with their thyroid, for example. I feel like Hashimoto's or just subclinical hypothyroidism is really common. I see it a lot. But
yeah,
just taking all of those things into consideration can start to improve both digestion and the brain. Because sometimes the anxiety is coming from the gut, but other times it can be driven by other physiological issues too. I mean, blood sugar issues and thyroid issues come to mind as two big factors in anxiety as well that can also impact the gut.
Right. And I want to circle back to those physical contributing factors to IBS. But you make a great point in terms of it's not just bi-directional gut brain, vice versa, but so many different directions where we have this input. And as far as the mental health component, you mentioned prior to our talk, as recently as 1997, IBS was considered a disease of hysterical women.
Isn't that crazy?
It's so crazy.
It's not that long ago.
Yeah.
And I think that mindset kind of carries over still.
It's crazy. And that's really to say, let's ignore assessing root cause and shame not just women, but emotional expression and stress response, I feel.
Yeah.
Not helpful at all and pretty lazy in my opinion. So
I agree.
It's just, we really need to look for these other contributing factors. And you also mentioned something really fascinating about food poisoning predisposing.
Yeah.
IBS.
Yep. So that's another thing that I'm seeing more and more too is, post-infectious IBS. And so what happens is Dr. Mark Pimentel has done a lot of research in this area, and he's looked into like anti-vinculin antibodies, anti-CDP antibodies. So what happens essentially is with post-infectious IBS is it actually becomes an autoimmune form of IBS. Mm. And so instead of just addressing the IBS, we almost need to take an autoimmune approach too, to calming the immune system down. Because when your immune system goes after this infection, once the infection clears, it continues to attack your intestinal lining by accident. It gets a little overzealous. And exactly. And it just starts to do damage, and it sort of gets stuck in this routine or this kind of vicious cycle. Yeah. And it continues to drive this this IBS process where you're having all kinds of gut issues. And so looking into that too, we're starting to come out with tests that we can tell if that's an issue, if it is an autoimmune attack as well. We can look at those different antibodies. There was actually a study on soldiers at war who came back with IBS. And I think most people were expecting to find, due to that stress connection. But what they actually found wasn't from the stress of combat, but they were coming back with IBS because they had gotten food poisoning while they were overseas. And so military deployment is actually a high risk factor for IBS. And it's because of that. It was because of food poisoning, not stress.
Yeah.
But that being said, stress, most people find that when they're stressed, their IBS flares too. So there's definitely a connection. And that's one of the reasons that it's so important when you talk about the bidirectional communication. The first thing I think of is the vagus nerve that connects our gut to our brain, and it innervates all these other organs. But one of the best things that we can do with that is just taking a deep breath. It stimulates the vagus nerve. And it also calms our immune system and puts us into this parasympathetic fight or flight mode. And that is something that people can do, if they set a timer for 60 seconds, a couple times a day or once a day, that goes a long way, and it really does add up. So it's all these things that we can do to start to calm down our bodies and help it to get back into balance.
Right?
I'm
It's all
so glad you
connected.
brought that up because I want to ask you, because I feel like you're an expert in this field for sure. You know, we talked about all of these stressors, whether it's lifestyle, whether it's environmental. What do you do every day? What small changes have you made that have stuck? What's your secret sauce in sort of minimizing all
Yeah.
those stressors?
Yeah. And so I'm a person who's like, go, 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 go. And so I know that it's hard. And when I'm recommending people, to build in daily meditation or stress management practices, I know that for some people that's doable and for some people it's not. And so that's why I like to start with the small things, picking one meal and sitting down and taking 3 deep breaths just to sort of put your body into rest and digest mode. When you feel that stress response rise during the day, just stopping and taking a few deep breaths. I mean, and our bodies love routine. And so when it comes to sleep, when it comes to our morning routine, I think that's something that's important to take into consideration too when we're talking about the gut and the brain, because if you're not getting 7 to 8 hours of sleep, that's how long it takes for your lymphatic system, your brain detox system to turn on and clear out toxins. And so if you're not getting good quality sleep, that's kind of a non-starter. You're not going to have the energy for healing. And so routine when it comes to when you go to bed and when you get up. A routine that I love in the morning is it's very simple and it's worked for so many of my clients. Just when you get up in the morning is when you're most dehydrated. And so you've been detoxing all night. And one factor, especially in constipation, is dehydration, not only at the cellular level, but their colon. And then obviously on the flip side, when there's diarrhea, there's going to be dehydration just because they're losing so much liquid. But just getting up in the morning and first thing you do is starting with a glass of warm water. I love to add either lemon or some electrolytes, medical grade electrolytes like Body Bio Elite or something simple like that doesn't contain a lot of additives, colors, sweeteners, things like that. And especially for people who struggle with constipation, getting up in the morning, hydrating your body. If you drink it in warm water on an empty stomach, it actually bypasses digestion and makes it to the colon. And that sort of glug, glug, glug action can sometimes stimulate a bowel movement. And so the combination of that with some sort of movement in the morning, and maybe that's a yoga routine or going for a short walk and then sitting on the toilet or using a squatty potty and making sure that your legs are in the proper position. When your body expects that routine, your bowels like routine too. And so I find that when people struggle with gut issues, with IBS specifically, creating a simple routine like that is really powerful.
That's great advice. And I've always heard room temp, but now I'm going to try warm. I haven't heard that yet. So
not hot. I just like it a little bit, just a little bit warmed up.
Okay.
Yeah, I agree. I think warm is it's a little bit more stimulating.
Yeah, I can see that. That makes sense. Awesome. Well, those are great, practical, helpful tips. So thank you. I'm curious if you have a case study that kind of stands out to you that might resonate with the audience. I'd love for you to share.
Yeah. There's a couple people that come to mind. I mean, it depends on what we're dealing with, but when it comes to the gut, I can't tell you how many people come to me with just this tiny list of safe foods. And there's one woman who had a really small list of foods that she could tolerate. She ate the same thing every day. She couldn't even tolerate binders. And so when we're talking about maybe going after bacteria overgrowths or dealing with, mold illness, she couldn't even tolerate binders. They were making her sick. And so in that case, you have to go even further back and to support the liver and lymphatic system and to make sure for minerals. I see a lot of mineral deficiencies in people who've been sick for a really long time or on a restricted diet for a really long time. And when you think about it, that's what we need to make our detoxification and digestion enzymes. And more people are deficient in minerals than vitamins. And so just starting with some simple things, reducing environmental exposures. I always send them an environmental exposure questionnaire to start looking through and figuring out if in her case, for example, you imagine the toxic bucket just overflowing, and how do we, one, start reducing exposures in air and water and food, in our skincare and home cleaning products, and then how do we support just the liver, the lymphatic system, maybe even taking supplemental glutathione for a while, just to help support those detoxification pathways before we ever even start going after any other overgrowths or infections, because oftentimes with someone like her, it just makes her feel worse. Mm. And then from the kind of the gut brain perspective, doing some sort of neural retraining is important, because a lot of women that come to me, I've been dealing with this for years or decades, and it's kind of like a well-worn rut on a dirt road, or our brain just gets stuck in this pathway, and we almost forget what it's like to feel good and to feel healthy, and to forget that we can feel healthy again. I mean, I know she was in this case, so in that boat. So something like heart math or DNRS can be really transformational in addition to the physical things.
So I take it she felt a lot better after working with you.
Yeah. And so that's where I've actually built in sort of a detox reset that I do with my clients, in the beginning, before we even dive into anything else, because I find that it helps us to get much better results when we go up just a little bit further upstream.
Nice.
And I have to ask, was she able to broaden her food list?
Yes.
Good.
She's finally starting to be able to add things back in. And, she was just in this chronic inflammatory response mode. And as soon as we started to make sure her drainage and detox pathways are open and things are moving, and that's something that's so important to ask too, is before we dive in and start going after these things that we find on the test, are you pooping at least once a day? Are you sweating? Are you doing all the things that, are you hydrated? Are you doing all the things that are going to support lymphatic movement and detoxification and elimination of things that we're unleashing into the bloodstream?
Right. And as we wrap things up today, Sara, I think this next segment is a really nice way to put together all these little features we've already touched on, including multitude of factors contributing to dysfunction, different body systems, and then the mental health component, which kind of really, it's impacted by all of this. And you shared this great article with us prior, and it sounds like a quirky horror film. The title of this article is Bread and Other Edible Agents of Mental Disease by Paula Bresson and Peter Kramer. And
Yep.
And I had a feeling that even the abstract would grab me, just like a good horror film, right? I knew that something in the abstract was going to be really, really good. The first sentence, I think it's the first sentence. They say, perhaps because gastroenterology, toxicology, and the nutrition and agricultural sciences are outside of their competence and responsibility, psychologists and psychiatrists typically fail to appreciate the impact that food can have on their patient's condition. How profound is that? And relevant to our conversation. So I'm wondering, Sara, how do we as functional medicine practitioners best coordinate care with mental health professionals? Any tips there?
Yeah, I think it's just a matter of maintaining that communication, sharing, if needed, sharing research. I mean, that's an article, like you said, that sounds like would come across on a horror film, but it's actually on PubMed. And it's something that I share with a lot of my patients just because it's an easy read. And, one of the things that gluten does is, and one of the things that's tested also in the wheat humor is, prodynorphin and gluteomorphin, the benzodiazepine family of wheat that cross the blood-brain barrier and bind to those opiate receptors, kind of like morphine and narcotics meds. So, things that we can do to connect it. And so I think when it comes to working with other practitioners, it's just about relying on our expertise, sharing the research and the knowledge, and sort of being on the same page and making sure that they're a practitioner who's open to integrating new research. And even if, that's not something they were familiar with before, making sure that our ultimate priority is helping that patient feel better, and being open to new ideas that are supported by the research in, whatever it takes, and making sure that we're communicating that plan and all on the same page.
And if they're not open-minded, we can definitely encourage our patients and clients to look elsewhere.
And that's where I think educating them and providing them the resources, they start to become their own advocate when they feel empowered to do that.
Yes. Well, I love that.
Yeah.
So true. Okay, so I think that we're towards the end, Sara, and you mentioned DNRS for brain retraining tools. Can you tell us a little bit about that? That's new for me.
Yeah. So dynamic neural retraining is more of a, it's a pretty intense program. It's an older, kind of outdated looking version, but it's very effective. It takes about an hour a day. It's a big commitment, but I think that's why I also really like heart math training. And that's something that I'm sort of integrating into my practice as well, because just that ability to identify when we fall into negative patterns and what an effect that has on our bodies. And emotions, there's no bad emotions or wrong emotions, but just understanding when things deplete us versus like renew and restore us. And the research is showing that there's like over 1,400 biochemical changes that take place when these hormonal shifts that affect you, not just momentarily, but for hours afterwards. And so it affects our cortisol, our adrenaline, our ability to calm our nervous system and to heal. And so that's where just understanding how to make these changes and sort of rewire our brains, especially when we've been sick for a long time, and catching ourselves and shifting back to more, renewing emotions and regenerative that stimulate these healthy anti-aging, anti-inflammatory hormones, and just kind of turning our immune system from something that's chaotic and energy draining to something that is priming us for healing.
Yeah, let's make the shift. Absolutely.
It's fascinating, actually. I love it.
Yep. All right. Well, all of this information has been so helpful. Sara, thank you so much for being here. We touched on the gut-brain axis and the impact on mental health and how they work both ways. All this information is extremely valuable. And before we let you go, I want to learn more about you personally. So if you're game, we'd love to ask you 3 rapid-fire questions.
Sure.
Awesome. All right,
go for it.
I know you love travel like me, so I'm wondering, what has been your favorite travel destination so far and where to next?
Oh, man. I have loved I've lived in Guatemala, so I love Central America. Italy is my favorite place that I've been to in Europe, but I just love traveling. We've bounced around the US a lot too, because I see patients virtually. We're currently living in South Texas, but I lived in San Diego and Southern California for 13 years. So anytime we get to go back there, it's probably my favorite place in the world. Just perfect weather, low-key vibe.
What part? I'm in Ocean Beach.
You're where?
I'm in Ocean Beach, San Diego.
Okay, Point Loma, just over the hill from OB.
On the peninsula.
Yes.
Yeah.
Yep.
Yeah, it's
So
beautiful.
awesome. Well, this isn't part of a rapid fire, but now I'm just curious. Are you fluent in any other language?
I speak Spanish, and I learned just enough Italian to go around and travel around based on my Spanish because it's so similar, but mostly just Spanish. So I lived in Guatemala for a couple of years.
Yeah,
it's a
that'll
little
do
rusty
it.
at this point, but yeah.
Very
cool. Okay. Second question. If you could have dinner with one person, living or deceased, who would it be and why?
I have no idea.
That's okay.
I have no idea who I'd have dinner with.
We can pass. You can.
Okay.
All right, let's try this one. If you could eat only one food for the rest of your life, what would it be?
When I lived in Guatemala, it would have been black beans. I was obsessed. We ate them every meal. But then my gut couldn't handle that anymore. So I love a good salad, and I love chocolate. So I don't think I think I have to pick
bipolar
greens
opposites
and
there.
chocolate. Balance.
We can incorporate chocolate into a salad some way, I'm sure.
I'll find a way.
Yeah, that's awesome. Well, Sara, thank you so much for being here. I've learned a ton. Tell the listeners where they can find you. And I have to say, I'm loving your new website. It's gorgeous. So
Thank
if you haven't gone, go check out her website, but tell everybody where you're at.
Yep. So I just rebranded, and you can check out my new website at vibrantvia.com, like the path to a vibrant life. And then I'm on Instagram and Facebook at Sara Beth Barthel.
All right. Well, you heard it. Thank you, everybody, for listening. And until next time, stay vibrant. Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness Podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guest and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.